Sickle cell disease is a major inherited genetic blood disorder in Ghana, and it is non-communicable disease. So it means that it cannot be passed from one person to another through contact. Instead, it is inherited when a child receives the sickle gene from both parents. So as at now in Ghana, it is estimated that about 18,000 babies are born with sickle cell disease every year. So upon the daily, day-to-day crisis that people living in sickle cell, they mostly go through, the current weather condition continue to pose a serious challenge for people living in sickle cell condition. We have a condition for people living in sickle cell called the vaso-occlusive crisis. And then bringing it down to everyone to understand, it's called the rheumatism and sasabro in our local language. Over the past few days, a lot of sickle cell warriors have been calling us just because of this current weather condition and the vaso-occlusive crisis has set in. And we have received numerous distress calls from sickle cell warriors and their caregivers across the country. So we therefore urge all sickle cell warriors and their caregivers to take extra precautions during this period. So in everything that we are saying is that we want the sickle cell warriors and their caregivers to also protect themselves from not even get this severe crisis. By drinking plenty water also helps. So we urge all sickle cell warriors to stay hydrated. Always you have to keep yourself very warm and avoid too long exposure to cold weather or rain. And then our caregivers we urge them to closely monitor the sickle cell warriors, the patients, and encourage regular fluid intake. If not water, it can be soup, it can be fruit juice, anything healthy. Keep them warm and never delay seeking medical care when the crisis develops. So all these things that we are calling for in response to this current situation, we have intensified public education and also engaged in the relevant health authorities. As at now, we've written formally to the National Health Insurance Authority, appealing for strengthened support by ensuring that essential medications that has been covered under the National Health Insurance Benefit Package for people living in sickle cell are consistently available and accessible to every sickle cell warrior who needs them. Because as at now, there are some medication that has been placed on the NHIS benefit package, which are the hydroxyurea, we have folic acid, we have brufen, we have petridine, tramadol, and other medications. Although it's not totally free, but it not being free, it has been subsidized. So you can get it at a low cost under the National Health Insurance Scheme Benefit Package. So that is what we are urging the authorities to make these medications available. And while the NHI continues to support this initiative, we are especially urging pharmacists at our teaching regional and district hospitals to ensure that eligible patients receive medication covered under the NHIS benefit package without unnecessary out-of-pocket costs, because we are receiving some costs also. That when you go to some of the hospitals, they will be telling you there's no medication, the medication that has been expected to be covered by the NHIS is not available and all that. We urge them, if it's available, they should make it more accessible for people living in sickle cell at this moment, because we really need them alive. We have also written to the Director General of Ghana Health Service, Professor Samuel Kaba, and the Chief Director of the Ministry of Health, appealing for coordinated national response to strengthen emergency care, support healthcare professionals, and ensure that sickle cell warriors receive timely, compassionate, and quality treatment during this period. Because at this point, a lot of sickle cell warriors will be having all complications, especially with the vaso-occlusive crisis, which is a very sudden pain that can attack any part of the body. And it is very emergency, life-threatening, because if care is not taken, the person may even lose their life just because there's no accessible treatment or treatment is not available on time. So this is what we are calling for. Because as at now, the calls coming, the pressure the people living in sickle cell and their caregivers are giving to FoSCel Foundation shows that there is a need for us to also strengthen the support to make sure that we care for them. The treatment are being accessible for people living with sickle cell so that this menace won't continue for long, because this weather itself is really cold and the rain is not stopping anytime soon. So we are urging the hospital facilities, especially some of our district hospitals, when sickle cell warriors, when they come to the hospital, because of how the pain is, they will be doing a whole lot of things, shouting and others. And we urge our nurses and doctors listening to us that they should manage to calm them. Sometimes because of how they are going through what, and there are some words and then any message that comes from some of the health professionals. Some of them even have decided not to even go to hospitals at all. Because as at now, if the crisis sets in and the person goes to hospital today, during the treatment and any other thing that the health providers will cater for them, the crisis may go off. I mean, you won't get the crisis again. You'll be relieved.